Glute and Core Activation Program Part 1. Your entire core is comprised of your glutes, abdominal muscles, lower back muscles, diaphragm, and pelvic floor. If these muscles are not activated and working synergistically as a team, increased risk of injury can occur. The core and glute muscles are meant to work together to stabilize the spine and pelvis in all activity, from getting in and out of a chair to performing squats or lunges at the gym. Therefore, it is crucial to address the entire core for many lower extremity complaints or injuries, such as chronic lower back pain, knee pain, or postnatal urinary incontinence, just to name a few. In this first part, we will focus on glute and core specific isolation movements. Glute activation. Our first glute activation exercise is clamshells. To do clamshells, you will lay on your side, roll your hips forward with your knees in front of you. Then you will lift the knee of the top leg up towards the ceiling while keeping your ankles together. You should feel the contraction in the back pocket area of your glutes. Hold the clamshell open for 30 seconds. Rest and repeat 3 times on each side. For side lying hip abductions, you will want to stay lying on your side with your hips rolled forward and your bottom leg bent in front of you. The top leg will stay straight as you lift the leg up towards the ceiling and slightly back behind the body. Hold the leg up for 30 seconds. Rest and repeat 3 times. To perform a bridging elastic band abduction, lay on your back and place an elastic band right above your knees. Bring your feet in towards your body, shoulder width apart, and push your knees away from each other. Hold this position, then tighten your lower abdominals. Squeeze your glutes and raise your buttocks off the ground, pushing through your heels. This will create a bridge with your body. Do not arch your back. Your back should be flat with your pelvis tucked to engage the core and glutes. Your knees should make a 90-degree angle when you are in the bridge position. If you feel this exercise in your hamstrings, bring your feet closer together and do not lift your bottom as high. Hold the bridge for 3 seconds, 20 times. While performing a banded squat hold, you will place a band above your knees and squat with your feet shoulder width apart. Weight should be on the heels and midfoot. Push your knees away from each other to create tension in the glutes. Your trunk should be upright with core engaged and back flat. Hold for 30 seconds and gradually progress to 60 seconds. Start with a light band and use a heavier one as it gets easier. Note that you should feel this in the glutes and a little bit in the quads. At first you may only feel it in the quads, but after a few rounds should be able to notice more glute activation. Repeat the 30-second holds 3 times. Performing a standing hip abduction with a band should be performed after you can perform a 60-second squat hold consistently. To do this exercise, place an elastic band above your knees and stand on your left leg with the weight primarily on the heel and midfoot. Then you will slightly hinge at the hip and bend your knee. Brace your abs and steady yourself on your left leg. Slowly lift your right leg diagonally back as you squeeze your buttocks. If you feel it in your lower back, readjust your position and make sure you are engaging your abs and glutes. Hold this for 15 seconds and gradually progress to 60-second holds. Remember to start with a light band and progress gradually. Core activation. Now it's time to do some planks. While facing down, lift your body up on your elbows and toes. Try to maintain a straight spine and do not allow your hips to drop. Keep the pelvis in a neutral position the entire time. Make sure to engage your core, squeeze your glutes, and keep your chin tucked. Hold for 30 seconds 3 times. If this is too hard, start on your knees. Once you have achieved 60 seconds on your knees, advance to toes. You should not feel this in your lower back. If you do, this means more core engagement is required. To get into a side plank position from a regular plank, you will want to shift all your weight onto one arm and one foot to face the wall. It's important to keep your body in a straight line by keeping your hips elevated with glutes and core engaged. If this is too difficult, start on your knees. Once you can do 30 seconds, then you can advance to your toes. To start, hold for 15 seconds and progress to 30-second holds, twice on each side. Don't forget to check out part 2 for our advanced glute and core activation exercises.